So good afternoon. I want to start by thanking General Jim McConville, Chief of Staff of the U.S. Army, for his support and for taking the time today to come visit us here in the Commonwealth and at the BCEC. But of course, being a native of Quincy, he's not that far from home, and I do want to welcome him back and say that anytime, General, you want to come hang here with us in the Commonwealth of Mass, we're thrilled to have you with us. General McConville is here to see firsthand the important work the men and women of the Massachusetts Army National Guard have taken on to support our COVID response efforts throughout the Commonwealth. General Keefe and his team have led the Guard in executing each mission they've been assigned, and there have been many, with efficiency, and they continue to be an integral and critical part of the state's COVID-19 response. We're extremely grateful to the men and women who have stepped up across the state to assist at the Department of Correction facilities in building out our field hospitals, supporting public safety officers, and performing testing at long-term care facilities. So far, they've made an enormous difference in so many ways. And they were also instrumental to establishing the Boston Field Medical Station here at the Boston Convention and Exhibition Center, Boston Hope. We just had an opportunity to take a bird's-eye view of the facility, and I just want to take a minute to thank Boston Mayor Marty Walsh and his team for all that they've done to help coordinate the effort, as well as Partners Healthcare, who's leading the clinical care efforts in partnership with Boston Healthcare for the Homeless, as well as B.I. Leahy, and so many other folks in our healthcare community to set this up. These field hospitals are crucial in reducing the strain on Massachusetts' healthcare system and have helped us add a significant number of beds as we deal with the surge. The Boston Field Medical Station will provide an additional 1,000 beds for COVID-19 positive patients, and they began caring for patients last week. I do want to say at this point that this whole facility was set up and stood up in about 6 or 7 days. And a big part of that effort was led by David Gibbons and the folks here at the Convention Center, but especially by General Jack Hammond from home base here in Massachusetts. I was on the phone with City of Boston folks and folks from many of the major Boston hospitals, and we were talking about the fact we needed to find somebody who literally that day would be able to start the work associated with setting this place up. And several people texted me in the middle of that phone call and said, maybe Jack Hammond would do this. And I've known Jack for many years, and many people here in Massachusetts and around the world know him because of the work he's done leading Home Base, which is probably one of the most important organizations in the country in helping men and women in the military deal with PTSD and TBI. But I called Jack when I got off the phone, and I said, how would you like to lead the effort to stand up a field hospital at the Boston Convention and Exhibition Center? And by the way, I'd like you to start this afternoon if you can do that. And Jack called me back, I think it was less than a couple hours later, and basically said, where do I go and where do I sign? And Jack, I just want to say, on behalf of the people of the Commonwealth, and especially on behalf of the people who will be served here and saved here, thank you so much for your willingness to bring all of your experience, your energy, and your expertise to this task. And honestly, I don't think we would have got there as fast as we did or as well as we did without you. God bless. Patients from hospitals both within the Partners Healthcare system and outside the Partners Healthcare system will be cared for at this facility, and the goal is to deliver care to patients that do not require hospitalization in an acute care facility. Now, in many cases, that's going to be people who are stepping down from a hospital-level stay so that other people will be able to come in to take the beds that they were in an acute care or an ICU setting. And based on the conversations that we just had upstairs with the folks who are involved in this, they now have roughly 90 folks in this facility. Is it 90 or is it more like 150? 150. It's 90 and 60, right? Okay. 90 on the hospital side, 60 on the respite side. Based on the conversations we had, it's working pretty much exactly the way it was intended to work, and I think for all of us, in some respects, that's a big, big relief as we move forward through the surge. We'll obviously continue to respond with every resource we have to ensure that we're providing the appropriate level of care to everyone here in the Commonwealth that needs it. This work would obviously not be possible without the healthcare workers who are here in the front lines, as well as many of the active duty and National Guard personnel who are also stepping up to provide support and service here, along with so many municipal and state folks from law enforcement and other parts of state and local government. And we are immensely grateful for everything everybody's doing to take care of people and help keep people safe here at the BCEC. And I should just say that if there are other healthcare workers who are interested in joining efforts here, they should visit www.partners.org/Boston Hope. Before I turn over to General McConville, I just want to give some quick updates on testing and personal protective equipment and hospital capacity. Yesterday here in Massachusetts, we conducted 7,971 new tests for a total of 148,744 tests conducted so far here in Massachusetts, which makes us a top 5 player in terms of testing per capita in the United States. There were about 2,221 new positive cases reported yesterday, and as you're aware, one of our #1 challenges remains making sure we deliver personal protective equipment to frontline workers, and we'll continue to secure that through whatever means we can. As of yesterday, we've made over 4 million PPE deliveries across the state since the outbreak. That includes almost 2.5 million gloves, over 370,000 aircraft masks, almost 200,000 gowns, and 437 ventilators. In terms of hospital capacity, we continue to monitor the situation at the hospitals and health centers across the Commonwealth. But generally speaking, as I said yesterday and the day before, people feel pretty good about where we are with respect to that, and that's been an important part of the way we measure our success, and not just managing the surge so that we can take care of people who are dealing with COVID-19, but to also make sure that our healthcare system has the resources, the capacity to take care of people for all the things that the system normally takes care of people for. I can't stress this enough. The work that's been done, I've said this several times over the course of the past 3 or 4 weeks, the work that's been done by so many people to set up so much capacity, both inside and outside our existing hospital system, so that our hospital system and our healthcare system would be prepared to deal with and manage our way through the surge associated with COVID-19, was in part to make sure we had the capacity, the skill sets, and the equipment and the support teams in place to make sure that we could help everybody who had COVID-19 work their way through that. But it was also to make sure that our healthcare system would not be overwhelmed by COVID-19 and would have the ability, which it continues to have today here in the Commonwealth of Mass, to take care of all the other things that everybody expects a world-class healthcare system like the one we have here in Massachusetts to be able to do. So, if you're dealing with something yourself and you don't feel well, you should absolutely call your clinician and make sure that you're not worried about the system's ability to meet your needs. The system can do that. That was a big part of why we all put so much work into building this excess capacity. Let me just close by saying this. Like so many things that have been forced upon all of us to change or adapt to in the wake of this pandemic, Massachusetts obviously looks a little different this weekend than it normally would. If it was a typical year and it was around this time of year, we'd all be well underway with the final preparations to welcome thousands of runners to the state who would be participating in the Boston Marathon on Patriots' Day. This year, while the race will not be taking place on Monday, the sentiment I think we all feel here in Massachusetts on Marathon Monday remains true, and that's that Massachusetts is strong, we are resilient, and we can run any marathon anybody wants us to run. We'll get through this crisis and we'll get through it together. But it's important that people and runners take the guidance and advice that so many folks in public life, including the mayor of Boston, have put out over the past couple of days and refrain from visiting the start of the race in Hopkinton, the end of the race on Boylston Street, or attempting to run the course. The many men and women that support the Boston Marathon include thousands of local, state, and federal law enforcement, members of the National Guard, and thousands of medical personnel. Those folks are exactly the folks who are currently helping us battle COVID-19, and they need to be able to focus on the work and the task at hand. Do not divert these incredibly critical resources away from the cities and towns that are along this course over the course of this weekend or on Monday. Everybody needs to continue to do what we have done so well for the past month or so, which is to stay at home, follow all the distancing guidelines and criteria that we've set up, wear a mask or a face covering if you can't keep distance between yourself and the people you come in contact with, so that we can stop this disease and run the big race that everybody thinks of as a signature event here in Massachusetts and in the city of Boston on September 14th. And with that, I'd now like to turn it over to General McConville. And again, I want to thank the General not just for being here with us today, not just for being a son of the great Commonwealth of Massachusetts and the city of Quincy, but for all of the service that he has provided over his long and glorious career as a member of America's military community. General McConville.
Well, thank you, Governor Baker, for your leadership, and thanks to Mayor Walsh for his leadership in taking care of my family that lives here in the state, and been very, very impressed with what I've seen here today. We are in a war against an invisible enemy, the COVID-19 virus, and what I saw here today is tremendous teamwork from the governor to the mayor to the real heroes of this fight, which are the doctors, the nurses, the medical professionals, and all the committed folks that are working against this. I had a chance today to go out and see what a great job the Massachusetts National Guard is, and I'd like to thank Gary, who's over the other side right there, for your leadership and what they're doing. They were out at many of the homes doing testing. They've been out at the Holyoke home for veterans, and they are really making a difference, and just very, very proud with what they're doing at Lexington, what they're doing at Wakefield, and what they're doing at Holyoke. Here we brought in 2 Urban Augmentation Medical Task Force from the reserves. They're working very closely with the team here to help take care of the Commonwealth citizens, and they are very, very proud to have this opportunity to serve side by side with the great medical professionals that are here. And so, again, we are here to help. We are here to support. This is a great city. It's a great state. It will prevail against this virus, and we will defeat this virus. So, again, thank you. We remain Army strong, Massachusetts strong, and Boston strong. And now I'd like to introduce Brian Golden for the Mayor's office. Thank you.
Thank you very much, Governor. Thank you, General McConville. On behalf of Boston's Mayor, Marty Walsh, welcome home, General McConville. Thank you for being here with us at Boston Hope, and thank you for the Army's decision to send medical personnel to treat people here at this facility. And thank you to Major General Keefe for the Massachusetts Guard's enduring commitment to the city of Boston. I've been in the Army for 27 years, And whenever you are in the Army on June 14th, you know that's the date on which the Army celebrates its birthday. That's when the big Army sheet cake is rolled out wherever you are at American military installation. That's when it was formally created by the Continental Congress in 1775. But practically speaking, the Army Reserve, and the National Guard were born this month. Actually, tomorrow is the birthday, 245 years ago, on the route from Boston to Lexington and up to Concord. This is where the Army's story began, and throughout our history, the Army has brought profound goods to the people of the United States and the world: safety, security, peace, prosperity, freedom, stable government. While it is the core mission of the Army and the other services to fight and win the nation's wars, there is another side to the uniformed services, their humanitarian missions, that don't receive as much attention. Yet year after year, the American military plays a role in alleviating human suffering at home and abroad. With skilled personnel and sophisticated equipment and extraordinary resources, they train and they build and they treat and they heal. Our service personnel, active, reserve, and National Guard, leave their homes and their families to help hurting people and broken places. Mayor Walsh and the people of Boston are indeed grateful for the Army Reserve medical personnel who've arrived in Boston, as well as for the Guard personnel serving here and throughout the state. In the same way, we also thank the hundreds of civilian medical personnel here, the first responders and police personnel who are here, state, city, and federal officials who are serving here, and in a special way, we thank General Jack Hammond and his team at home base for making it work 24/7. So the American Army's story, really the American military's story, began here in Boston on April 19th, 245 years ago. And today it continues with the selfless men and women who are here to fight the good fight alongside the people of Boston. On behalf of the mayor, thank you again, General McConville. Thank you, Governor. Thank you, General Keefe. And thank you to all who labor here at Boston Hope. It's now my pleasure to introduce Dr. Greg Meyer, the president of Newton Wellesley Hospital.
Good afternoon. I'd like to thank Governor Baker, Lieutenant Governor Polito, Mayor Walsh, his administration, Boston Healthcare for the Homeless, thank you, Barry, General Jack Hammond, General McConville, General Keefe, and the dedicated men and women of the United States military for what is an amazing partnership here at Boston Hope. I am very proud as an Air Force veteran to say that we are working side by side with some of the best physicians, nurses, and medical support staff from around the country and bringing them together with our world-class care here in Boston to provide a service that is so essential to our community at this time of need. It is that amazing partnership which has made Boston Hope possible. A week ago, this 1,000-bed facility began caring for patients in need of respite and who needed additional care after their release from an acute care hospital before they could return home. Some will come to this facility as a transition from hospital care. Others will come here for a safe place to recover from what is this vicious virus. It took a strong team of healthcare professionals, contractors, policymakers, and others working around the clock to make this facility a reality. We should all be proud of how far we have come and how wonderful the resource we have created through these efforts. Clinicians, support staff, environmental services workers, logisticians, and others have raised their hand and compassionately and courageously stepped forward to ensure that we can provide wonderful care for the city and region here in Eastern Massachusetts. There are two important benefits that Boston Hope will bring our community. The first is it will allow our acute care hospitals to do what they do best, to provide acute care. This means that we'll be able to concentrate our world-class expertise in all of the hospitals and health systems around this region to ensure that we are available for patients who need care for COVID and non-COVID related illness, as the governor said so importantly just a few moments ago. Another important function of this facility is going to be able to provide a space that is safe and welcoming for individuals who are not yet ready to go back to a safe home or safe shelter to be able to recover completely from their illness. In addition, with time, I expect that this facility is going to play a very important role in the recovery of our healthcare system here in the Boston and the region of Eastern Massachusetts. In particular, this will allow us to, again, move patients who need a lower level of care to a facility that allows our hospitals to begin to open up and provide the acute care that they do very best. I would like to echo the words of Partners Healthcare President and CEO, Dr. Ann Klebanski, who told me that Boston Hope has been a significant undertaking, but every one of our partners knows that a challenge tends to bring out the very best in this city and this region. We are not wasting this crisis. In closing, I'm going to put on my hat as a physician and say to you what the governor has been telling us all along. We need to keep socially distant and physically distant from each other, practice superb hand hygiene and wash our hands often and use our alcohol cleansers. Stay home if you can. And in addition to that, I would urge you, if you need care of a medical condition, COVID or non-COVID, the hospitals and the medical centers in this region are open to you and they're available to provide care. And part of that is enabled by the wonderful work here at Boston Hope. Again, I would like to thank all of our terrific partners here, all of the other hospitals and healthcare systems who have been so integral to this work to make this a reality. Thank you.
Questions for folks?
Governor, I was just curious if you had the opportunity to speak to any of the patients or doctors and nurses in the field hospital, or if you were too far away.
We didn't go into the hot zone, but we did talk to Dr. Meyer and several other folks. And I've talked to people over the course of the past 4 or 5 days over the phone who've been involved in serving people here, as well as some of the folks who are working on the respite side. Gotcha. What I would say is part of the reason we decided that there was a big debate and a discussion about whether, what type of facility this should be. And we eventually decided, based on the guidance we got from a lot of folks in the healthcare community, that the best way to do this, and from the City of Boston, would be to make it a respite facility for folks who are unsheltered, and to create a COVID-positive facility overall, with a clinical element on sort of one side of the trade floor and a respite facility on the other side. And I think that decision, which, as I said during my remarks, makes it possible for the healthcare system in the region to be able to use this facility to transfer people who no longer need to be in an ICU or an acute care bed, but still need to be watched and taken care of, so that the hospital itself can be available on the ICU and on the acute side to take new people, has worked exactly as I think many of us hoped it would. The other thing I would say is, by having a clinical facility that sits literally across the trade platform from a respite center, means if some of the folks on the respite side get particularly sick, they have the ability to access a world-class, first-class healthcare facility that's, literally a walk away, which is in some ways a real benefit of having both of those operations set up in this facility.
And you said Thursday was I think the highest number of tests that you guys have done since this all began.
Yep.
Yesterday, it's somewhere in the 7,000s, which is still
Almost 8, yeah.
So which is still double what you were originally planning on doing. Why, just for the sake of asking, do you still need to do even more testing?
Well, I think testing in some respects is ultimately about surveillance, and surveillance is the mechanism through which you can establish a robust contact tracing program, which we're currently standing up with our colleagues at Partners in Health, with the local boards of health and our Department of Public Health, because I think it's our view that ultimately, no matter how you think about what's going to happen over the course of the next few weeks here as we deal with the surge, at the end of the day, the most important thing we're going to need to be able to do is identify people who have been affected by the virus, get in touch with them, help them isolate, and then help anybody they've had close contact with isolate as well. And that, from our point of view, I think is just a crucial element in our ability to provide people with confidence that that we're doing all the things we need to do to contain the virus on a go-forward basis once we get past the surge. And you know, if you were to say to me today, what's the right number of testing, I would say I'm not sure. I just know it's a lot more than we're doing now, even though we're one of the 3 or 4 biggest testers on a per capita basis in the country right now.
The other thing I would ask too, in regards to PPE, you said yesterday that you're going to be providing PPE to firefighters and police officers across the Commonwealth. Yesterday we endured another death of a essential worker at a grocery store, and I know in just speaking with people personally with different cities and towns saying you must wear some sort of face covering, but they're complaining that, well, where do I get one? How can I get one if they're in such short supply? So my question is, are you guys looking at potentially providing those face masks to essential workers in grocery stores, and then obviously making them more readily available to the public?
So I fully expect that over the course of time, you're going to see a lot more production ramp up in the mask space generally. It already has started, and I'm sure it's going to accelerate. And it's going to be an integral part of how we think about sort of getting back to what I think the so-called new normal will end up looking like. Part of the reason we made a number of the we issued a number of the orders and advisories around grocery stores was to protect people who worked in them. If you wanted to change the shift you were on, if you wanted to work in a different part of the store, you know, under one of our orders, you could do that. Going to a 40% of occupancy standard was designed to empty the facilities out and have fewer people in the facilities. The face covering issue, remember, it's face covering or a mask. It doesn't have to be a mask. It just has to be something that covers your nose and your mouth. As I travel around the Commonwealth, I see a lot of people wearing bandanas and scarves and heavy turtlenecks and all sorts of things. If you don't have a mask, I'm sure you've got something in your wardrobe, or somebody has something in your house that could be used as an alternative to a mask. That's partly about protecting you, but it's also about protecting you from other people, because as we've said several times, one of the great challenges with COVID-19 is the fact that people are infected but asymptomatic and may not know they actually have the virus. And that's why it's so important, if you're going to be in a grocery store, in a pharmacy, in some other place, any place where you can't legitimately physically distance yourself, you should be wearing a face covering or a mask.
Last question.
I had a question for
Earlier
the
this
general.
week, you had a text that went out from the state's COVID texting service that said that nursing homes and assisted living facilities need help now. Could you just speak to this? Because obviously there's a lot of people who are leaving those jobs, but you need people to take care of those who are sick or who need help who are in there.
So one of the things we've been doing over the course of the past 10 days or so is creating a series of initiatives to support both the residents and the people who work in long-term care facilities. One of those is the mobile testing program, and we're one of the only states in the country that has one, which is being led by the folks from the Guard. And they've done, I don't have the numbers in front of me, but I think they've hit close to 250 facilities at this point. Over 300. I was being conservative. Okay. And somewhere in the vicinity of 5,000 or 6,000 tests. And in addition to the work that the mobile units are doing, which literally can go to the facilities and do the testing based on what guidance the facilities give or that we get from the folks at the Department of Public Health about who to test and all the rest, can then work with the homes to basically separate COVID positive residents and staff in some cases from folks who don't test positive. And one of the things about long-term care facilities and assisted living facilities is they're basically set up for people to engage with each other. That's the whole point is not to isolate people. And you have a lot of staff who work in a particular function where they work the building. They don't necessarily work a wing, they work the building. So one of the things we've been doing with our colleagues in the nursing home and long-term care and senior care environment is helping them think really differently about kind of the rules of the game in a COVID-19 world. And that means more testing, thinking differently about the whole social interaction piece that we've always thought of as fundamental to the health and well-being of the people who are being served, creating wings that serve COVID-positive folks and getting everybody else into other parts of the facility, and continuing to expand what I would describe as the knowledge base around how to provide care in these settings. In addition to that, we've also worked pretty aggressively through our command center to do outreach and to create financial incentives and financial resources for nursing homes. And we've put, over the past 10 days or so, about $130 million in additional financial support into our long-term care partners, and that came with a whole series of initiatives around attestations with respect to financial support for staff, as well as signing bonuses for folks who go to work for some of those facilities during this very difficult and challenging time.
General, I just had a question for you in regards to your experience fighting wars. How does this battle compare to the traditional war zone that you have experience with?
Well, as far as I talked about, this is a little more challenging in that you have an invisible enemy, and you can't see it. And as a fact, that's why the measures that the governor talked about are so important. The social distancing, those who don't need to be working to stay at home, and really to limit it. What this is all about is limiting exposure while we get to the point where you increase the training, the testing, and then get to the point where you have vaccinations where you know who's been infected and who's not, and we have the proper treatments in place. So, the military's job, the Army's job is to protect the nation, and we have a threat right now, and that's why we're here to assist communities like the great state of Massachusetts and Boston.
Can you speak to how upsetting it must be to see the loss of life amongst these veterans and the veterans' homes across the Commonwealth? Yeah,
I mean, the loss of life is absolutely terrible. We don't want to lose anybody, and these are fathers and mothers and wives and husbands and maybe even sons and daughters. So my hearts go out to them. My condolences go to the family. But we have this virus, and we're all going to work together with a whole of government effort to defeat it, and we will defeat this virus.
And another question for you or the governor as well. I mean, we're 2 days away from Patriots Day. We're standing here in front of these symbols, Boston Hope, which is the same symbol that was used in the wake of the Boston Marathon bombing. These doctors and nurses are not fighting limbs being blown off. Now they're fighting this invisible enemy. I guess my question would be, what's your message to these healthcare workers as they battle this virus as well?
Well, it's interesting. During the Boston Marathon of the bombing, I was actually commanding the 101st Airborne Division in Afghanistan at that time, and I was so proud of the city. I was so proud of the state because they became Boston strong. They became Massachusetts strong, and they will defeat this virus. And I'll turn it over to the governor.
I mean, the one thing I would say about this is, and it's been part of a conversation that a number of us have observed, is usually when you go through a tumultuous event or a heroic event or horrific event of some kind, it's usually visible, right? When you go through 28 days in a row of snow and temperatures below 20 degrees and the sun never comes out, you can see it. When you go through something as horrific as the marathon bombing 7 years ago, right up the street from here, you could see it. You could see the chaos it created. You could see the heroism it generated. You could see the military and the law enforcement and the first responder and the medical personnel pouring onto the street to serve people. You could see the damage that was done to people in the aftermath of that. What we're dealing with here, as the General said, is an invisible, insidious enemy. And if you go outside and you walk around, it looks pretty much the same as it always did, except there's nobody on the streets, and there are very few automobiles, and everything, for the most part, is closed. And I think that speaks to some extent to the very different sort of psychology that's associated with battling a virus relative to the psychology of battling an enemy or an event or a disaster that occurs, natural, man-made, or otherwise, that's right in front of you. It also has a beginning and usually an end. One of the things about this is, because of the unprecedented nature of it, we don't really know exactly when it's going to end. We have a bunch of data that we've collected from the experiences of other countries, and we started to collect data from our own experience, from the experience of other states here in the U.S. But this is a very different kind of battle, because so much of it is being fought against an invisible, insidious enemy that, in many respects, we're still learning about. And I think one of the great challenges that this presents for all of us is vigilance. And the General talked about hygiene and distance and face coverings and all the rest. You know, that vigilance, when you're dealing with an enemy like this, really matters. And playing by the rules and understanding why they're important really matters. And if you look at the way the Commonwealth has responded to this, or you look at the way municipal officials have responded to it, you know, we've all made adjustments based on what we see on the ground across the Commonwealth, or in particular cases in particular communities, and we've changed the rules based on what we see. But we are constantly dealing with this virus that is a very different kind of engagement, different kind of battle than the one where you can actually see what it is you're up against. And I say to people all the time that what I do know about this is we are getting smarter about it all the time. The more we test, and as we really ramp up our tracing program, the more we're going to know about the things that work and the ways we can combat this and contain it and run at it, which is part of what I really want to do with that tracing program. And as all the smart minds that exist in this country that are chasing treatments, and there are many, by the way, that are, where'd Greg go? There are many clinical trials going on right now in Boston hospitals on certain treatments for this virus. And one of the leading companies that's working on a vaccine for this virus is located here in Massachusetts. I mean, there are a lot of people taking a hard run at this thing, and I believe they will ultimately, as the General said, be successful. But in the meantime, we're dealing with something that's unlike many of the traditional or typical, if there is such a thing, disasters and battles that we fight, which is this one's up against a novel virus, which comes with a whole new set of challenges. And I absolutely believe that people are doing all the right things to meet that challenge. But we've got to stay vigilant and follow the facts and make adjustments based on real data and real information, and recognize and understand that this will be, to some extent, a marathon for us as well.
Thanks, everybody.